Early symptoms of HIV can be easily mistaken for other illnesses. This is why it's so important to get tested if you have any concerns. Common symptoms in the early stages include fever, chills, rash, night sweats, muscle aches, sore throat, swollen lymph nodes, and mouth ulcers. It's important to note that not everyone will experience all of these symptoms. Some people may experience no symptoms at all. Section 5. Early diagnosis is key. Early diagnosis of HIV is crucial. It allows you to start treatment early and live a longer, healthier life. When HIV is detected early, it can be managed more effectively, reducing the risk of complications and improving overall health outcomes. Early diagnosis also helps in preventing the spread of the virus to others, as individuals who are aware of their status can take necessary precautions. There are several tests available to diagnose HIV. These tests are designed to detect the presence of the virus or the body's response to it. The choice of test may depend on various factors, including the time since potential exposure and the availability of testing resources. The most common is the antibody test, which detects antibodies to HIV in your blood. Antibodies are proteins that your body produces in response to an infection. This test is usually performed using a blood sample, but it can also be done using oral fluid or urine. Other tests include antigen antibody tests, which can detect HIV sooner than antibody tests alone. These tests look for both HIV antibodies and antigens, which are parts of the virus itself. Antigen antibody tests can identify HIV infection in its early stages, often within a few weeks of exposure. Another type of test is the nucleic acid test, or NAT, which looks for the virus itself in your blood. NATs are highly sensitive and can detect HIV infection very early, sometimes within days of exposure. However, they are more expensive and not as widely available as other tests. If you're diagnosed with HIV, your doctor will work with you to develop a treatment plan. This plan will be tailored to your specific needs and may include a combination of medications and lifestyle changes. Regular monitoring and follow-up appointments are essential to ensure that the treatment is effective and to make any necessary adjustments. Treatment typically involves antiretroviral therapy, or ART. ART helps to control the virus, reduce the risk of transmission, and improve the quality of life for people living with HIV. By adhering to the prescribed treatment regimen, individuals can achieve and maintain an undetectable viral load, which means the virus is not detectable in their blood, and the risk of transmission is significantly reduced.